All right, let's play medical detective for a few minutes. We're going to tackle a fascinating case where the main clue is a mysterious rash. Our job is to follow the evidence and figure out exactly what your skin might be trying to tell you. Let's get started.
So here's the central question driving our entire investigation. Imagine a patient walks in with this very specific, widespread rash. Where does your mind go? What should you immediately suspect? We're going to look at a few possibilities, but only one is going to fit all the facts.
You know, every great mystery starts with that first critical clue. And in our case, it's this rash. Really understanding what we're looking at is the absolute first step to cracking this whole thing wide open. Okay, so this rash has a technical name. It's called petechiae. And the most important part of that definition, these aren't just red dots on the skin. They are actually the result of minor bleeding from tiny broken blood vessels. That right there, that's a huge clue. So let's get our magnifying glass out and examine the evidence. The spots are tiny, pinpoint-sized. They're red or purple. But here's the real clincher. They're non-blanching. That means if you press on them, they don't turn white or fade away. And that's how we know for sure it's caused by bleeding under the skin, not just some surface irritation. This is a vital piece of the puzzle.
All right, we've got our primary clue locked down. So what's next? Well, it's time to bring in the usual suspects. Based on what we know so far, there are 4 potential medical conditions that could be the culprit behind this rash.
And here's our lineup. First, we've got leukopenia, which has to do with white blood cells. Then there's thrombocytopenia, which involves platelets. Our third suspect is polycythemia vera, an overproduction of red blood cells. And finally, hemolytic anemia, the breakdown of red blood cells. Each one seems plausible, but only one is going to fit our evidence perfectly.
And now for my favorite part of any investigation, the process of elimination. We're going to take each suspect one by one and hold them up against our key piece of evidence, that petechial rash, and see if their story checks out.
First up to the plate is leukopenia. This is just a low white blood cell count. Now, don't get me wrong, this is a serious condition that puts you at a much higher risk for infection. But does it cause bleeding under the skin? Nope, it just doesn't fit our evidence.
So that's a clear mismatch. We can confidently cross leukopenia right off our list. One down.
Okay, next up, polycythemia vera. Now this one is kind of the opposite of what you might expect. It's when your body makes way too many red blood cells. The problem here is that your blood can get too thick, which can lead to clots, not the kind of spontaneous bleeding we're seeing with these petechiae. So, another dead end. Polycythemia vera is officially cleared. It's not our culprit. 2 down.
How about our third suspect, hemolytic anemia? Well, this is all about red blood cells being destroyed too quickly. And while that definitely causes big problems like serious fatigue and maybe even jaundice, that yellowish skin tone, it doesn't cause a petechial rash. The symptoms just don't line up.
And just like that, hemolytic anemia is out. Through the power of good old-fashioned deduction, we're left with just one suspect.
Okay, with 3 suspects eliminated, our focus now shifts entirely to the last one standing. This is it. This is where all the clues finally click into place. The mystery is about to be solved, and it all comes down to these tiny little things called platelets. And here it is, our culprit, thrombocytopenia. It's a bit of a mouthful, but all it means is having a low number of platelets in your blood. And what are platelets? Well, they're the tiny, plate-shaped cells that are your body's first responders, rushing to the scene of any injury to plug the leak and stop you from bleeding. And really, this is the heart of the whole matter. Platelets are absolutely essential for forming clots. So when their numbers drop way, way down, your body loses its ability to patch up even the tiniest little breaks in your blood vessels, and spontaneous bleeding can just start to happen. So here's exactly how it happens, like a chain reaction. First, the platelet count drops. Because of that, your ability to form clots is seriously impaired. Then, those tiny microvessels start to leak and bleed. And what's the visible result of all that widespread tiny bleeding? You guessed it, petechiae appear. It all connects perfectly.
And if you need any more proof, look at the other signs of thrombocytopenia. They fit the profile to a T. On top of the petechiae, you'd also expect to see larger bruises, maybe some bleeding from the gums or nose, and just generally bruising way too easily. It's a complete match. Case closed.
So, we solved the mystery. Awesome. But honestly, the most important part of this whole thing is understanding what this clue really means. Why is it so critical to be able to recognize this specific sign?
This is the single biggest takeaway I want you to have. A widespread petechial rash is not just some minor skin issue. It is a massive warning sign, a giant red flag that your body is waving to tell you something serious is going on with its ability to stop bleeding.
So when you see this kind of rash, it's screaming three things at you. 1, the platelet count is dangerously low. 2, there's bleeding happening in tiny vessels all over your body. And 3, this is very likely happening because of a serious underlying condition. Could be an infection, a bone marrow problem, or even a bad reaction to a medication. So, to go all the way back and answer our very first question, when you see a diffuse petechial rash, what should you suspect? The answer is thrombocytopenia. It is the one condition on our list that perfectly explains all the evidence. Let's end with this, because it sums it up perfectly. It's not just a rash. It's a direct visual sign that there's a major problem with the body's clotting system, and being able to recognize it is the crucial first step toward figuring out the cause and getting the right help. And that leaves us with one last thing to think about. Our bodies are constantly sending us signals, and if a rash made of tiny dots can point to such a specific and serious condition, it just makes you wonder, right? What other silent signals might our bodies be sending us every single day? Thanks for joining me to solve this medical mystery.